guests are healthy. And lately, one of the larger challenges I've faced, and I think some of you have faced as well, which is why there are 100 people on this phone call, has been what to do when someone shows up and they're positive, either a guest or an employee, and how to get some kind of, so what we're looking for today is some guidance on testing, strategy, execution of that opening and reopening. As Erica said, everything's going to change, and we're in the restaurant business, so we understand that nothing is ever the same. But as I've fielded phone calls, as I'm sure many of you have, about what to do in terms of the virus, it just strikes me that I'm not the person that should be making public health policy or decisions here. And then my friend Richard, Dr. Pan, the senator, has been very helpful for me as a go-to to ask for advice and what we're doing here. And so not only has he offered his advice, but he's reminded me regularly that the county in California is, at the end of the day, the people who have jurisdiction over health and makes those final decisions. So he has been forthcoming in his advice while being mindful that he doesn't want to step on the toes of the county. But still, the state guidelines clearly outline that we should be seeking guidance for opening and reopening strategies from the county. And so he's going to be here to help us with those options and chime in, because he also is, as he said, a public health doctor as well. So this is his area of expertise. Richard, you want to say hello to the crowd?
Yeah, no, thank you so much, Patrick, and thank you for convening this meeting with the Chamber. And again, I want to thank Dr. Beilenson as well. I know that from talking to Patrick that many of you have fairly specific questions about what you should do, and I think it's important we try to give you some guidance. This is a fairly new virus, so things do change, but we do know quite a bit about it as well. So hopefully we can give you some guidance that can help you with your businesses in terms of what you can do to keep people safe and healthy. And we all know that if we want to bring business back, people have to have confidence that they're going to be safe going to shop, going to restaurants, going to different places. So aside from all the other stuff that's sort of happening, across the state, we want to be sure that each of you can feel confident and be able to share with your customers that confidence that you're doing what you need to do to keep them safe, so that they're confident they can come shop at your restaurant or store or whatever. So again, appreciate this opportunity, and I hope we can get Dr. Beilenson on the line, because as Patrick said, and I'll say, is that he is the final arbiter in terms of the specifics of what we do, but I'm also here to hopefully help provide some guidance and direction and as far as what we need to do to try to keep people safe and have people feel confident about coming to business. And I see Dr. Beilenson has shown up.
Yeah, I think I'm on the phone. Thank you, Senator, for your lead-in here. Let me just give a brief update of where we are, and then I'd be very happy to take questions. I think that's probably the most useful use of our time. Can you guys hear me okay? Can you hear me, Senator?
Yes, I can hear.
Okay, so a quick update on where we are. We've had 1,000 cases in the last week or 8 days. Put that in perspective, we had 2,000 cases in the entire first 19 weeks of the outbreak. So we've gone from being one of the lowest per capita case rates in the country among major urban areas to not as great. Because we bent the curve when we started out, but we have not bent the curve as much recently. Those 1,000 new cases are interesting because they are quite different than our initial 2,000 to 3,000, in that they're overwhelmingly Hispanic. The Latinx population is almost at a plurality of the number of cases that we have now. We're within about 20 cases of the white community. And the community and the folks that are testing positive are much, much younger. They're about 40. About 70% of our cases are now 40 and under. That's important for a couple of reasons. Number one, obviously they're going to be healthier because they're younger, but they're also much more likely to be what are called super spreaders, because they're more likely to be asymptomatic, not have symptoms, and therefore not know that they're sick unless we get them tested, which is why our test sites that are community-based sites, which we've just closed down for a couple of weeks because of a lack of reagent, which I'll get back to in a minute, but it's why our community-based sites are so important, is because we were doing a lot of asymptomatic testing to be able to find people. So that's where we are in terms of number of cases. The number of hospitalizations we have, despite the fact that there are a lot of 40 years and younger, they've gotten people sick on the older side. And so we have 140 people in the hospital now with about 50 people in the ICU, compared to 8 in the hospital and 2 in the ICU about a month ago. So we've had a significant increase in the number of hospitalizations as well. We have enough beds right now to be relatively comfortable, but we need to not use the surge capacity as much as we possibly can, and that's why we want to bend the curve again. In terms of the number of deaths, we're at 76, which actually for a county our size is pretty low. Virtually every single case, if not every single case, has been a senior, 65 or older, or someone with underlying health conditions. Tragic, but more expected than a lot of the 40-year-olds and 30-year-olds that have died in other places of the country. So that's where we are in our number of cases, hospitalizations, and deaths. What we know about our cases from our contact tracers, who I think you guys know what they are, the people who trace people who turn positive, find out who they've been in contact with, and get them tested and isolated to keep them from expanding an outbreak. The contact tracers have picked up 3 basic themes. Well, actually 4. 1 are bars, which are now closed, obviously. 2nd are family gatherings and extended family and friend gatherings at people's houses without masks, without social distancing. That's been the number one cause. And then in addition, there have been a lot of migrant workers and service workers who are predominantly people of color because they've been stuck with the jobs that people have to do to keep people moving in the world in terms of groceries, et cetera, et cetera. So that's generated the Hispanic population increase. So that's where we are right now. I'll be honest with you, and as you know, I'm pretty frank, that as far as we can tell, the restaurants have not been a major vector of disease, which I think is why they've been allowed to stay open outdoors, and obviously for takeout and delivery, although that's not as helpful as in dining. So anyway, let me stop there. I've talked a lot, and I'd be happy to take questions, and as I know Senator Pan would as well.
Well, actually, I think we have a set of questions that are more specific about what restaurants should do. Were you going to answer those first?
Thank you.
I will if I can see them.
And maybe I'll lead off with them for you, for Dr. Beilenson, a few for you, and also for you, Senator Pan. I think especially for this group, one of the big questions that keeps coming up is, if one of my employees is either exposed to COVID-19 or tests positive for it, what do I do? Let's start with that.
So if someone tests positive for it, they're out for 14 days. They're isolated for 14 days. It's conceivable that it could be a slightly less period of time, but to be safe, that makes the most sense. For people that are exposed to someone who tested positive, depending on the exposure, and we consider close exposure to be more than 15 minutes face to face, less than 6 weeks without a mask. That's sort of in a nutshell. Those people would need to quarantine for 14 days. There's been a question about, well, why not just test them? And if they test negative, then they let them come back to work. And the answer is that because of the incubation period being 2 to 14 days, a negative test doesn't mean that they're actually negative. Does that answer the question?
I believe so. And again, I'm going to leave it to the audience to add to the chat if they have a follow-up tied to that. On that same regard, if you have an employee that tests positive for COVID, whether it's because they're working for you or for another establishment or another employer, what steps do you now need to take in your restaurant, hospitality, bar? Do you need to close down? If so, for how long? Do you need to do a thorough cleaning? Anything along these lines that you can give of what's either required or recommendations you would provide?
So number one, a thorough cleaning. Number two, it depends completely on whether the person, on the individual case in many ways, like how much time they've spent in your operation versus other operations. Is it a waiter or a server who only works 2 days a week in your place, and the last time they worked there was 10 days ago, et cetera? It really is a bit more nuanced than that. But basically, if someone tests positive and you know they test positive and they've disclosed that they tested positive, no matter where they were located, whoever has been closely exposed to them in your restaurant would need to be quarantined for 2 weeks, and that probably is ample.
So actually, just to follow up on that, Dr. Beilenson, so suppose there's a waiter, right, who recently is working in your restaurant or worked in the past couple of days. They're interacting with customers. They may be interacting with other waiters. They may be interacting with some of the back staff. The restaurateurs would probably know better than I exactly who they're interacting with, but my guess is they probably are interacting with a lot of people. If they did a shift, they probably were there for at least several hours, not just minutes. I mean, would that require that restaurant have to close? Or, I mean, what level of exposure does it trigger the restaurateur to say, okay, I have to close, or I have to now quarantine my entire staff? Or so can you give a sense of the sort of the thresholds that they should be, that would trigger this type of?
Yes. So again, with any individual diner, it's very unlikely that you would have had that let's say it's a server rather than a cook. A server who's been going around and has 22 tops he's got to deal with, and it's unlikely that they would have this kind of extreme exposure of more than 15 minutes face to face without masks, less than 6 feet away. That would be unusual for them to have that much exposure, I would think, having been a restaurant with a server before. Similarly, in terms of their exposure to their colleagues in break rooms or whatever, if they didn't have that kind of exposure, then they would not really need to quarantine those folks either. Anyone that they did have close exposure to should be quarantined for 14 days. And if enough people, I think in answer to the question that Senator Pan was asking in terms of potentially closing it down, if enough of your staff obviously was quarantined and had been exposed, it would make sense to shut the place down, probably for 2 weeks.
Okay.
What do you think, Senator?
Well, actually, I'm sort of looking at, I don't know, Patrick or one of the restaurateurs. Did that help answer the question, or is that is there a follow-up that may provide some clarity?
Yeah, so Doctor, what you're saying is if it's just one person, right, and so it's not a breakout, right, which I believe is defined as 3 or more people from different homes in 2 weeks in one workplace, then the challenge, then probably you don't need to close. Here's the challenge we're facing is that each of us are making our own decisions, and we're really looking for a little stronger guidance for that testing and strategy and execution from the county. And while the doctor has been very good, as he points out, you're the final arbiter. And so if one person gets sick, and here, just as an example, in Sacramento, one person in a restaurant gets sick, one restaurant closes, cleans for 38 hours and comes back, another does 3 days and then comes back, and a third quarantined and closed everyone for 14 days. Now, all those instances were because one person came up sick. It's a challenge because we're lacking. What we're looking for is guidance from the county.
So I understand that very clearly, and I know this is not a great answer, but our capability in terms of our capacity is stretched very, very thin. And normally our public health division would put out guidance. Now the state has put out guidance on this that's fairly detailed. Is that not helpful? Do you guys all have that?
The state guidance does not refer to restaurants though, right? The state guidance, there's state guidance for groceries, food packing, agriculture, hotels and lodging, but not for restaurants specifically. And the state guidelines, what they do say is you need to go to your LHD or local health department seeking guidance on testing strategy and execution, and also to go to the LHDs to facilitate what options are available, practical, and epidemiologically sound.
So
looking up.
maybe too, and follow up with that, Patrick, and for Dr. Pan, we can follow up with his office. I know that the state has provided a lot of guidance on how restaurants, bars, restaurants, and similar open, and those in-dining guidelines are now, as we talked about, external dining.
Yeah, there's some July 2nd, 2020, there's dine-in restaurants guidance from the state.
And I think to that, and maybe Patrick, to your question, a lot of questions we're receiving is that provides guidance on how to operate, not necessarily on if somebody tests positive for COVID-19.
Yeah.
Maybe to summarize, Dr. Beilenson, one of the key things I heard you say, and I want to make sure this group knows, is it's less about quarantining the place, knowing what we know of the science of the virus. It's important to clean surfaces, ensure that a complete scrubbing, so to speak, is done. But it really has more to do with the people, the number that were exposed, and quarantining the people to ensure that, again, they've either been tested, had that 14-day time period before they return to work. Is that, again, just an overarching kind of accurate assessment?
That is overarching the correct assessment. As you learn more and more about the virus, there's less and less likelihood of it being communicated by touching things. Not that it's impossible to do, but it's vastly more worrisome if you talk to someone without a mask on less than 6 feet away, and especially if you cough on them and don't wash your hands and hand sanitize. I'm reading through the guidance now, and I think, Erica, you're correct. And Patrick, I think you are correct in that it talks a lot about how you operate and disinfect and clean, but very little about reopening or opening or closing. So one of the things that I'll pledge to do after this is make sure that our public health division puts out a guidance in terms of when you close and what you do. Let me just caveat that by saying that there's a lot of nuance in this, and that's part of why we have contact tracers to contact the people who test positive and find out who their common denominators are, so that we can actually jump on these cases ourselves rather than make you guys handle it.
And maybe, Dr. Beilenson, on that note, it's one thing if your employee notifies you or they come back with a positive test. Can you maybe talk briefly to, in that time, if whether it's a customer or employee who notified you they tested positive, as an employer, what do you need to do? Do you need to notify your staff? Do you need to notify your patrons during that time?
If a customer, if who tests positive, a customer?
If it's a customer and or an employee, what next steps do you need to do? And this might even go into what you are now leading with some of your contact tracing.
Okay, so there is HIPAA, obviously, which we all know about, which does not require you to disclose a thing to your a medical condition to your employer or people that are working where you're utilizing this. And Dr. Pan, please join me on this. That being said, we strongly encourage people, obviously, to let their ownership know if there's a positive test. There's much less of a worry, frankly, from a customer's point of view to the servers that are working there, because it's very unlikely that they have 15 minutes of close contact without a mask, although obviously people who are dining would not wear a mask while they're dining.
Yeah, so one of the things is that if you do have first of all, your employee is not compelled to tell you if they're positive because of HIPAA, because that's health privacy law. If they tell you, it's advisable, although you're technically as employers, you're not, I mean, HIPAA's applied to health professionals in healthcare settings, but would suggest that if is not to reveal who said that they were positive, to protect your employees' privacy, if they tell you. Sometimes that can be a little tricky in terms of trying to figure out who's exposed and not. if you're asking around. But I should point out again, employees are not required by law to tell you if they are positive. Hopefully they're responsible and they will do the right thing in terms of quarantining themselves, not just show up at work if they've had a positive test.
And then Richard, reading through my understanding of the Cal OSHA, that it's required if there is a known hospitalization or death due to COVID, but not a positive test does not trigger the requirement for you to contact Cal OSHA. Would that extend to the Department of Public Health or to the LHD, in this case, Sacramento Health?
Well, the LHD and the Department of Public Health are the same thing. And actually, we're the ones who get notified of every single case. So we would get notified, yes, not just of the hospitalizations, but of all the cases.
Yeah, so if there's a positive test, the person performing the test, the lab or whatever, should be notifying, or the doctor who ordered the test should be notifying Department of Public Health. So you may actually hear from the Department of Public Health, who wouldn't be able to tell you which employee, but if there's a contact tracer, may be in contact with you if there's someone who was at your business or an employee of yours was positive. Your employee's not required to tell you though. So that information does get channeled to public health.
So that raises for me two questions. So are we still, what's the requirement then for us? Are we required to go in? And then if public health comes back to us and says someone is sick, but we don't know who, what steps should a restaurateur take?
The public health department will know who it is, and they would give you guidance in terms of what you need to do and who needs to be potentially tested or quarantined. But the public health department does know the identity of the person.
Right, and I guess, Dr. Beilenson, what we're looking for is some guidance so that we know ahead of the health department just walking in and telling us, so we can have some kind of strategy, some preparation, some thought in what a game plan might be. And that's where the frustration lies, I think, on the part of the restaurateurs on this phone call.
I'm sorry, I'm not clear. In terms of being ready for someone,
if someone comes in and an employee comes in and tests positive, restaurants in Sacramento right now are closing, but they're closing from 1 to 3 to 5 to 14 days.
Right.
We're not doctors. What do you think? What should we do? Right? I mean, so what we've gotten so far is, we just need specific guidelines, and we're happy to know that these are the best guesses of the smartest minds, but we're not doctors.
Okay,
and we feel, and I think it's safe to say that we feel like we're being put in an untenable situation, because then the public health issue, the people are coming to us rather than to the public health officers.
Right. No, I hear you, and that's why I was saying we're going to get a piece on closures, because that's the thing that seems to be missing from the guidance for you coming out of this meeting.
Okay. Dr. Beilenson, maybe to switch topics real quick too, there was a couple questions here that referred to testing. So part of this could be, as an employer, am I responsible for my employees to get tested? Where do I send them? What type of tests are out there? Any general testing information you can provide this group?
Yeah, well, we're unfortunately in a bad situation right now, which I think Dr. Pan has just heard about, and you guys may have as well, in that we have a national supply chain problem with the reagents, the material that's needed in the machine to test if people are positive or negative. So we've had to close down some of our community-based sites temporarily while we work to find other workarounds. In addition, the main labs that do the testing for people that are in the private sector, that have private docs, et cetera, as well as our Cal Expo site, is Quest. And Quest is at 100% capacity, and they're still taking 8 to 9 days to turn around their results, which is virtually useless. So I don't have any good news on the testing front immediately. Right now, the best place to so first of all, you are not responsible for testing your folks, A. B, if you want to recommend a place for them to go, probably the best place is the Cal Expo Verily drive-through, which has 400 slots a day, but they are basically full all the time. So that we're stuck in a federal national issue right now, and it's a statewide issue obviously as well. So there's no really good answer to your question. The main point is if someone feels ill, because that's likely why they would ask for a test, they should go home and quarantine for 14 days, period.
So actually, just to clarify, Dr. Beilenson, first of all, I just want, in terms of testing, while certainly testing provides some information and perhaps some reassurance, a lot of the actions that you take are regardless of a test result. So, because even if someone is tested, what it tells you is in a window of time, they may be positive or negative, obviously negative being the better situation, but it doesn't mean that they may not be, potentially infected, but the test was either done too early or they didn't have enough viral load or something. So generally, most of the guidance is that if you've been exposed, and Dr. Beilenson, you correct me if I'm wrong, if you have a prolonged exposure where it's high risk, right? So no mask over 15 minutes, et cetera, and someone's been positive, they're exposed to, then you're just quarantining. So that's regardless of test, correct?
Correct.
Right. So, okay. So now on the testing side, we unfortunately, with the increase in cases across the country, we've unfortunately, I'm not going to be political here, but we haven't had leadership to solve our supply chain issues. So we're outstripping our supply chain issues for doing tests. If someone is ill and symptomatic, they should self-quarantine. If they think they're really ill, they should contact their doctor. And we can get tests more quickly for people who need medical care. So UC Davis, other types, they have labs that can run it. But generally, so we can get people taken care of if they are sick and very symptomatic and need help. But in terms of testing people in general right now, because of the national situation, unfortunately, we're not able to get people tested as much. But in some ways, the situation is we're testing itself is not necessarily driving some of the decisions to be made about quarantine. It's really about the situation and exposure risk.
And
Dr.
Dr.
Beilenson, I don't know if you want to elaborate on that.
Just
Can I ask a follow-up question?
please.
Yeah, sure.
Yeah, so in regards to testing and the 14-day quarantine, so if somebody tests positive or was exposed and we have to quarantine them for 14 days, do they have to test before they return to work?
No.
So it's just a 14-day window and then they come back to work?
Well, I take it back. The caveat is, assuming they were not symptomatic. If they were symptomatic, it has to be 3 days after their last symptoms and they're not taking an anti-fever medication. But basically,
So
if there was someone that was exposed, then and doesn't have symptoms, yes, 14 days is all they need.
Okay, but if they were a positive test
Yes.
and they were asymptomatic, it would follow the same guidelines. So 14 days, no symptoms, good to go. If they had symptoms, then they would have to be 72 hours with no fever and no medication to reduce that fever. And would they have to be completely asymptomatic, or would their symptoms have to have just improved at that point? Because I know on the CDC guidelines, it just says symptoms improved, not gone.
They have to be afebrile without a fever.
So, but if they have a cough, even though they have no fever.
Yeah. Yeah.
So in that case, they could return?
As far as I understand, so as you can tell, there's a lot of inconsistency in the federal guidelines, and there's just not everything that we need to know about the virus right now. So I know some of this is frustrating, but as far as I understand, it's 3 days after the relief of symptoms and no fever.
Okay,
Richard?
and that's in addition to the basic 14-day window of time.
No, that's actually after. It's about 13 days, but yes, it's easiest to say 14 days.
Right. So if they go on a 14-day quarantine and on day 10 they have no
Yes.
fever and
Yes.
their symptoms have improved, on day 14, they could return.
Yes.
Okay, thank you.
Dr. Pan, there's maybe a follow-up question I want to have for you on testing, and then move to one or two others from the group.
Sure.
And again, for everybody, I know sometimes this can be very frustrating. We are learning new things about the virus every day. And in business, we like predictability, and it is really, really hard right now. So appreciate our guests trying to address these questions the best they can. But Dr. Pan, with that said, you mentioned a comment about expedited testing. For our restaurants, they are dealing with shortages of workforce as it is at times, whether it's because people have to be at home for their youth and their children because there's no daycare or school, and or they are single parents or caring for someone else or concerned about, their own health. So that said, is there expedited testing opportunities for certain industries, including restaurants, that can help with this, whether it is recommended by the employer or available to the employees via federal, state, county, or similar?
So the challenge is that with the shortages there are in things like reagents. So basically those are the supplies necessary to perform the test, right? So whether it's the swabs or now I think it's reagents, it's the issue. We have to then prioritize who gets the tests. And you do get expedited testing for people who are in the hospital, right? Because they are the ones who are particularly sick. Nursing homes have been another site where we've had a lot of infection, plus the death rate's very high amongst the people who are in nursing homes. So they also have a certain level of priority. I think that given the supply situation, because of the larger number of cases across the country, there's going to be challenges to say, well, the question is how many people do we expedite and what's our actual capacity? So Quest is 100% full right now. So I think before, when we weren't having spikes in Texas and Florida and Georgia and these other states, we were able to turn things around much more quickly. Now the problem is we are competing for those supplies with these other states which are having skyrocketing cases, as well as, of course, our own cases have been going up. So I hear what you're saying. Certainly, we know that we want to try to do what we can to help businesses get open. I think we have a testing task force. We've expanded our testing capacity. We actually, in the state of California, have been doing over 80,000 tests a day. But the challenge is that the only way we can do those tests is if we have all the supplies coming to us. And unfortunately, now there's competition for those supplies because the number of tests that have to be done is increasing. It's increasing. Now we're having to prioritize people who are ill at this point. So this is one of those moving target situations. Hopefully, if we can get not only supply chain improved, but if they actually get some control over what's happening in Texas and these other states, maybe we can get back to a situation where we can make tests more available to businesses that have to make decisions about their workforce. I'm not sure at this point we are in this current situation. We're there right now. We were a few weeks ago. Unfortunately, we're not now. I hope we can return to that because that would mean overall things are getting better. But I am not aware, we'd have to check in with the hospitals and so forth, their capacity. But I think we are trying to they all work together too. We've all been working together to figure out how we pull capacity. So this is a supply chain issue and demand issue, a national one.
Thank you, Dr. Pan. Dr. Beilenson, a couple of the questions we got from audiences and participants had to do with private dining. So a lot of our restaurants either have space that's dedicated towards catering, group events. For some of them, that's their primary focus and business model. Should they just be following the same guidelines that are part of the state's restaurant and dining guide, with the social distancing, with the limits on occupancy, or is there other things we need to be mindful of?
No, they shouldn't be in dining at all. You can have outdoor dining and you can have pickup and delivery. That's all that's allowed right now.
So again, just to reiterate, if they have outdoor space, they are following restaurant guidelines. Current indoor space can be used. If in the future it changes and in dining returns, would they be following probably some of those restaurant guidelines then?
Oh, yes, I see, yes.
Okay. and maybe on that note, I do want to maybe add something from a positive standpoint. You kind of led and mentioned, I know there were some recent studies that as far as outdoor dining, we are seeing very low situations that, again, more and more the science is telling us being outdoors is good, low transmission rates, all those kinds of key things. Is that's something that you are seeing from a county level, continuing that, knowing that we're seeing little if no testing results or positive cases coming from that outdoor situations?
Yes, and actually that's backed up by the protests. We've had only 4 cases that have been identified from the protests, despite the fact that they were outdoors. And we think that's because of 2 things: they're wearing masks and they were outdoors.
Great. Senator Pan, a question maybe to go to you that we got from someone was, and we're seeing this, you know, with the governor's order on everyone wearing masks, a lot of the burden and the enforcement has gone on business owners. From an enforcement standpoint, is there anything for this group to be mindful of, whether it's a customer walking in who's initially not wearing a mask before being seated, and or you know, even employees who are not following the guidelines?
Well, I mean, it really is about establishing social norms here. And so I guess what I would urge people is to have, you know, we have no shoes, no service policies, to consider no mask, no service policies. I realize that in some ways, the more people who do that, the more we establish the social norm. So we don't want to put the burden on a handful of people who try to do this, because then they become the target for people who may, for some reason, don't want to follow those types of guidelines. There is a overall mask order. I'm not saying, you know, don't get into a fight with your customers about it, but I think that if we saw, you know, people had signs and you set the expectation like, hey, if you don't wear a mask coming in, that's not good for my business. That also is gonna, you know, I don't want to have my restaurant or store closed down because someone didn't know they're positive and we find out later. I mean, I think that's a kind of conversation or, you know, signage to consider. I think the more that we all collectively do that, then that sends a strong signal to people in the community about what the expectations are. Certainly, you know, there is a governor's order. There's a task force that's looking at different ways of enforcement. You know, the governor doesn't have a personal police force. I mean, there's the CHP, but they're not usually charged with patrolling, you know, neighborhoods. They're the highway patrol. So we do have to work with local law enforcement. You know, and I think, again, the approach isn't that, first of all, sending people to jail for not wearing masks doesn't make sense anyway. The jails are full enough. We have enough disease there, right? It's really about establishing the social norms around this. And while certainly we can try to cite people for that, I think ultimately, the more people see that everyone is asking them to wear a mask, then the more likely I think people will say, hey, you know what, maybe I need to do that. So I guess what I would urge is that as many businesses as possible can put up signage or something saying that's what we want you to do because we want to keep our own workers safe and want to keep all our customers safe. Then that becomes the social norm. If it's only a handful of people doing it, then people think, well, you know, it's just those businesses and I'll pick on those, et cetera. So we can work together on this. That'd be great. Certainly, I'm constantly telling people wear a mask if you know, when you can.
And if I could just add real quickly, I make visits every day to sites all over the county. And I've been very impressed in general by most places having 100% masking policy. But if you have a problem with either patrons or even a employee, although you should be able to handle the employee, call 311 and they will come out and they will do educational enforcement first before anything else.
Hey, Richard. Yeah, I just wanted to follow up. It's still not clear on closing the restaurant or not, right? And I guess no one's going to give us an answer, so I'll try one more time, right? If there's a breakout.
I said that I would get the one thing that will come out of this meeting that's, I think, useful to you all is guidance on when to close and how long to close for.
Okay, and it would be helpful
that's what I'm promising.
if that guidance would include outlines for testing. And then Richard, would there be a way, if the supply line opens back up again, for hospitality workers as essential workers to be prioritized from the state point of view in terms of testing as a way to help the public feel safe about going out to eat?
Well, let's put it this way. Why don't we look at what our capacity is here in our region, and looking at and working with the different people who are doing tests, hospitals, other types of sites, Quest, et cetera, and see what we can do at least regionally. I know you asked about statewide. Usually the state, because the state's so big and diverse, it's hard to set up a whole statewide guideline, but maybe let's see what we can try to do in the Sacramento region, both in Sacramento County, maybe some of the other county health, other counties surrounding as well, to think about, looking at our testing capacity here and what we can do to try to help prioritize tests for, that would help keep businesses open. Does that make sense, Patrick?
Yeah, that's great. Thank you.
There's a few folks I'm going to put on the spot who sent us some questions. One being Henry DeVere. I know you had a few questions. I want to make sure they got addressed today, and anything else you want to follow up on.
Yeah, thank you. I did have a question. How far are we from getting patio dining removed and/or a stay-at-home order, and what could or possibly trigger that? For us, it's about trying to see ahead and manage inventory levels, and if there's any kind of key pointers that might push us in that direction, especially like maybe 2 weeks after 4th of July, what has to happen for you guys to lean towards issuing that back?
So it would have to be a pretty significant continued increase in the number of cases. As you were pointing out, the 4th of July results won't be in for a week or two in terms of number of cases because of the incubation period time. So what we're seeing now is what's happened over the past 2 weeks, basically. And if we can start bending the curve back down, I don't think that they'll close up the outside dining.
Yeah, I mean, this is really, when we were looking at the data, you have to think, when we talk about hospitalizations, we're really looking at something that happened 2 to 3 weeks ago, maybe even 4 weeks ago. When we look at deaths, it's about 6 to 8 weeks ago. When we look at even positive cases, we're talking about people probably exposed about a week ago, 2 weeks ago, potentially. So probably more like a week ago. So as we look at these numbers, I think this is really about, if we can get people to, in the beginning we said everyone stay at home, right? Because we didn't know what to do, just shut everything down, right? Now we know if we can get people to wear masks and keep their social distance, or keep that distance for most part, and I think a lot of people are cooperating. That's why if we can all do that together, we can keep the number of cases down enough, then hopefully we won't actually have to go back to a shutdown. A shutdown would be a pretty big step, and we know now what we know about the virus indicates that we should be able to do something short of a shutdown, right? So that's going back to the mask wearing and the keeping people distant, when they're in different settings. And again, indoors is a little trickier than outdoors, because indoors seems to be where people get infected as well. So hopefully we can get through this without having, I'm cautiously optimistic that as long as we all work together to tell people to do those simple things, wear a mask, try to keep your distance. You don't have to stay at home all the time. Businesses will help keep people spaced out a bit, then we won't ever need to go to a shutdown situation.
And Dr. Pan and Dr. Beilenson, if I can follow up, are there metrics that we can look at, right? I grew up reading the racing form in the morning, right? Are there numbers? Is it positivity? Is it infections per 100,000 people? Is it hospitalization rate? Is it death? And should we be looking at IMHE, Johns Hopkins, COVID California, or Sacramento dashboard? I mean, frankly, although the Sacramento dashboard seems to be trailing sometimes in terms of date.
No, Sacramento dashboard is usually updated by the end of the day, and is certainly the most up-to-date stuff we have about Sacramento. That's very useful. That has cases, it has hospitalizations, it has ICUs, it has ventilators available, surge capacity, epidemiological data, and number of tests. So that's probably the best. The IHME, which is the University of Washington's predictor, has not been as good as it was originally. So I don't know if I'd use that. Hopkins, both Dr. Pan and I come from, so I'm a little bit biased towards them, but they tend to be pretty good. And the California COVID lags us. So I would argue that probably Sacramento COVID-19 is the best dashboard. And again, what specific metrics to look for? There's no one specific metric. We kind of take it as a holistic approach. So, for example, there could be a ton of cases, but no deaths within a few weeks, and very few hospitalizations, in which case we would not be anywhere near concerned, as if we had a lot of deaths in fewer cases. So it really depends on sort of the nuances. I know I keep saying nuances, but that's basically the truth. Erica, Erica, I have to get off. I have a contact tracing meeting that I have to attend at 4:30.
Thank you, Dr. Beilenson, and I again apologize for the technical difficulty. We'll make sure that if there's any follow-up questions, we'll send them to your office. And many of the resources you shared, we'll make sure that this group has it as well in a follow-up.
Okay, and I'll get the follow-up piece to you by the end of the week.
Thank you very much.
Okay, bye, Richard.
All right, bye. All right, let me take a shot at your question, Patrick, as well, as Dr. Beilenson's leaving. So first of all, I would, the positivity rate, if it keeps, it's actually the trend. So if it keeps going up, the positivity rate, it means that the disease is continuing to spread. So that's usually not a good thing. It has been going up. So we'd like to try to get that to flatten out and go down, all right? Now, the part that when we said, well, what might trigger a shutdown? So the thing that I think that we'd be most worried about is we start using up all our hospital and ICU spaces, right? So we don't want people to end up in the hospital and ICU, and we want to keep that number as low as possible. But if we're looking like we're going to top that over, that's going to create, that's sort of a trigger for, well, we need to do more, right, to slow this thing down beyond. So, so if it looks like our ICUs are going to be completely full and the hospital's going to be completely full, or we're approaching that level, that will put some pressure on decision makers to say, well, maybe we need to take further steps than we're doing now, right? So, so we're not there yet, and admittedly, we're actually even taking in people in the hospital, and hospitalizing people here for people who were actually from Imperial County and from other parts of the state, because we do have some beds here. So I don't see us approaching shutdown point here in Sacramento, at least at this point. I am concerned the positivity rate continues to increase, but I think, again, we know what we need to do. If we can do the masking and the social distancing, we can try to flatten this thing back out again, and then hopefully get the cases to go down.
Karen Holmes, I know you had a question, and I know keeping, we've been talking about community spread. Someone might have been exposed in their home or their work environment. It might be a question Dr. Pan could answer. Do you mind addressing it or asking?
Do you want me to ask the question out loud?
Please.
Sure.
Okay. So if I had an employee who had a family member and they all live in the same household, and they tested, one of the family members tested positive, but my employee tests negative, but now they're all living in a small house together. After a 14-day quarantine, can I decline to allow her to come back because I feel like this virus is within the household and it sort of needs to run its course?
Okay. That's a tricky question. So first of all, if we have, so one of the things that we need to work toward is, I don't know if you heard the term test, trace, isolate, right? So test is testing, and then trace is the contact tracing. Isolating is what happens if you have someone who's positive and they happen to live in a large household. If they live by themselves, easy thing, stay at home. If they're in a household with other people, especially if there's a lot of other people and there's some high-risk people, what do you do with them? And especially if the other people in the household are negative, do you basically put them somewhere else, right? Isolate them, find them a hotel room or something and isolate them. Because the challenge is exactly what you talked about, is that, okay, now we have someone who's positive, they're in a household, so there's a high likelihood that they are going to infect the other people, even if they're currently negative, right? And then what do you do? And how often do you keep testing the other people in the household? And if you said one of those other people in the household is one of your employees, what do you do? Because you almost have to presume they might be positive because the other person was positive. They're in close contact with that person. So I think that's that becomes one of the issues. I guess if so I don't give the official word because it's Dr. Beilenson, who's the county health officer. I think that we need to figure out how to sort that out. One thing was after the 14 days, do you test everyone else in the household and that person, and now that everyone else is still negative, then they're good. So whether that's something that one would do, I don't know. Ideally, what you do is if someone's positive and they were living in a household, you would isolate them so that you kept them away, and then test everyone. If they're negative, then keep them separated until the 14 days is over. So
But
that's the official answer.
As an employer, can I decline to allow her to come back after 14 days because it feels too scary?
Yeah.
It feels too.
So I'm not an employment law person, so I just want to be careful that I'm not giving so I'm not sure where the employment law thing lands on that. I mean, so if you said I'm not going to let you back, I'm not paying you and all this other stuff, I'm not sure how that fits in terms of that situation. I think that there certainly is a place where you could say, well, you know what, I'm not sure you're negative, and of course there's other people here, so I don't want you returning back to work. But what your obligations are to that employee, I cannot say off the top of my head. We'll have to have someone follow up with you on that.
So Richard, I have a follow-up here, and it goes to you saying that Dr. Beilenson is the final authority, but here's the challenge, is that with all due respect, he's not really giving us answers. And the state clearly says that we should be looking to the county health department for testing strategy and execution. Not getting that, what's our next option?
Well,
right?
so he did commit.
Two pieces. So one, thank you for coming here as part of that answer. But the second piece is, if the health department isn't saying this is good or this is bad, this is what you should do or this is what you shouldn't do, how do we build up public trust? What we do every day, people trust us with the most sacred of things, which is to feed them, provide them nourishment.
Right.
And we've been asking from the county for advice or guidance or support that this is a safe thing to do. Or it's not a safe thing to do, and fuck it, I'll close down and we'll move on. But not getting that answer, that's the challenge. So from our point of view, we're not getting that answer from the county. So the question from many of us is, what's our next step?
Okay. Well, first of all,
I hope he comes with this guidance by Friday, and that it's great and detailed and answers everything. But I don't hold out great hope.
Okay. Well, he did make a commitment to do this, so I think we need to give him a chance to do it. I can understand why he didn't want to just rattle something off the top of his head right away, right? And I think part of the reason we had this meeting is to lay out to everyone that we need to have this guidance, right? So certainly, I will be following up with him to see how that's going. Hopefully, when you get the guidance, you tell him, did this work or not for you? Is this sufficient? Is this not detailed enough, et cetera? I think also what I'm hearing from you is there's probably some folks we want to reach out to in the state. So because to see whether I can get him some state help advice as well, because actually, even if he comes out with a great set of guidelines in Sacramento, I know some of you have businesses in other counties as well. And there was an article, I think you forwarded to me, Patrick, and I actually read it earlier. San Francisco is struggling with the same thing. The restaurateurs are like, we don't have specific guidance. So that's clearly a void. And I think I'll certainly bring that up with our state health department as well. It's like, hey, you have a guidance on how to operate, but counties are struggling with, and restaurateurs, businesses are struggling with, well, what do I do when we don't have guidance on what to do when customers are positive, employees are positive, things like that. We need to have more specifics. And also even not just their CDPH, I think some of you also, made reference in some of your comments. I've been trying to glance at them on the side, with some of the, like Cal OSHA and so forth. So being sure we're all coordinated there between public health, Cal OSHA, because as employers, you have to deal with OSHA and so forth, that we're giving you accurate guidance and some specificity so that you can have that.
So Dr. Pan, thank you for that.
Erica?
Yes.
Erica, I just want to say thank you. Thanks, Doc. I mean, I really appreciate it. I know this is not comfortable for anyone, and probably good that you already know my personality. Maybe it makes it easier for you, but let me say, on behalf of the restaurateurs on this Zoom call, if there are things that we can do to help push that along, to get more clear guidance, to get support from the state, to let the state know that there is a sense of urgency out here, please contact Erica, like volunteering other people, and we'll get on the phone. We'll make those phone calls. We'll do whatever it is that you think is most effective to get this moving. Because really, at the end of the day, all we want is for everyone to be safe, and what we miss most of all is our customers, and we want them to come back, and we want them to enjoy themselves.
No, I appreciate that. I'm not in the restaurant business, but my family, my wife runs a small business, and when there's lack of clarity, she likes to bring that up to me as well and says, fix this. So I hear what you're saying. I appreciate you convening this. I want to thank everyone who took the time out to join us today. And again, looking forward to working with all of you. And I hear what you're saying. We're going to try to work on this, and certainly I do understand your frustration. So hopefully we can try to address that.
Well, and again, thank you, Dr. Pan. I know this has not been easy for some of these questions, knowing that we are missing some information out there. 2 things for this group I'm hearing, or 3 things in follow-up. One is we're going to circulate what existing resources are out there, including, I'm going to give you guys a free 800 number that can help you with some of the questions on insurance and HR. A lot of the questions seem to focus on an HR side of things. Can I bring an employee back? What's disclosed? What's not disclosed? I'm going to set up something pretty quick here. We can get some HR experts to help answer those direct questions, because there are some nuances. And with that too, if you're not aware, the city of Sacramento passed an ordinance that's going to affect, give or take, mid-July, that has some new requirements on employers as far as safety and environment, and ensuring that those are included in the work environment. So we want to make sure you are familiar and aware with those. And then we will follow up with both Dr. Beilenson and the county on a guideline specific to this industry, but also on the state level, Dr. Pan's office. Maybe Dr. Pan, this is too where we can engage the governor's task force, if that is meant to be a group with subject matter experts, to provide input on the effects of industry. I think we've got approximately 100 subject matter experts here who can help give some guidance based on day-to-day things they're dealing with. So we'll make sure that that is done as well. And lastly, Chef, I want to thank you for pulling together this group and this community. I think, we are the Farmsport capital for a lot of reasons, and it's because many of the faces, numbers, and the folks that we see here today and the many they represent. Is there, Chef, anything else you want to share with this group for kind of closing thoughts or comments?
No, thanks very much, everyone, for coming in, and I appreciate you coming, because it puts a note on everything that there's 100 of us out here saying, how do we make things better, right? We wake up every morning to make Sacramento a better place, or try anyway, and I appreciate you guys coming out to help push to get better guidance. And again, thank you to Dr. Pan and Dr. Beilenson for taking that time out and coming to talk to us.